We just learned some skills that will help us communicate better with residents and understand what matters to them in their daily care. You make a big difference in delivering age-friendly care, and you matter too. Now we're going to talk about communication skills that you can use in conversations with residents, coworkers, and even managers and supervisors. When you practice good communication skills at work, it can help you manage stress and improve your sense of confidence. As a CNA, effective communication might be one of your most important responsibilities. Sometimes communicating with others doesn't come naturally or easily, and sometimes your communication skills might need to change depending on whether you're talking to residents, their family members, or caregivers, or your coworkers and supervisors. Regardless of who you are talking with, an essential communication skill is active listening. Listening is a skill, and not everyone knows how to do it effectively. Listening is extremely important for successful communication in nursing, so learning how to listen effectively is necessary for good resident care. Active listening starts with inviting conversation, and then listening to what a resident, caregiver, coworker, or supervisor is saying. You can practice your listening skills by asking open-ended questions and avoiding asking questions that can be answered with yes or no. Next, repeat what you hear. When you repeat back part of what someone says, you're showing that you're listening. Try to respond to nonverbal communication. Reading body language can be helpful with active listening. If someone isn't making eye contact, it could be a red flag that they aren't comfortable. If someone's brow is furrowed, they may be nervous or worried and need to be comforted. In nursing communication, your ability to read body language can greatly influence your relationship with your residents. Patience, empathy, and trust will improve with your efforts to actively listen. By practicing active listening, residents will feel more comfortable and safer in your care. As I mentioned earlier, body language or nonverbal communication is extremely important to understand in many situations. That means we should be aware of our own body language as well. If the messages you speak don't match the signals being sent with your facial expressions and movement, your messages might be interpreted incorrectly. Your posture, eye contact, and facial expressions should match your verbal communication. Self-awareness can help you match your body language to your messaging, and it will help you pick up on others' nonverbal cues. For example, if your tone is gentle, your touch shouldn't be aggressive or harsh. When a resident is talking, avoid crossing your arms across your chest. This can be seen as a sign that you are closed off. Finally, try to offer an open front. If you are antsy or distracted, someone could assume that you are too busy or needed elsewhere. You can communicate more effectively if your body presents an open stance, ready and willing to receive incoming information. Eye contact is also important. You want to look the person in the eye to demonstrate that you are focused on them and the conversation. However, be sure not to stare at the person, which can make him or her uncomfortable. A relaxed, open stance, arms open, legs relaxed, and a friendly tone will make you appear approachable and will encourage others to speak openly with you. Now let's talk about verbal communication. It can seem like all you do during a shift is pass messages, from resident to nurse or doctor, and back to the resident. Whether you are on the sending or receiving end, it is important that you use clear communication in nursing. Residents or loved ones are likely to ask questions and share concerns with you. You'll want to be sure to communicate clearly to prevent unnecessary stress or confusion. Start by creating a foundation. Let your resident or their family know who they are talking to. If you are able, use your first name. This helps them relate and establishes a feeling of comfort and trust. Next, encourage open communication. Offer time for the receiver to ask questions or react to your messages. Remember to read body language. Is the individual tensing up, looking down, or crossing their arms? If so, take time to offer comfort by repeating your message in another way or confirming they understand by asking a question. For example, you can ask, "What other questions do you have? What can I clarify?" You might need to modify how you speak. The tone and speed of your message can change based on the communication you are sending. There are many reasons a resident might need you to slow your speech or raise the volume of your voice. Try to be direct. It isn't always easy to be direct with communication, especially if it's a difficult subject for the one receiving the information, but it is generally necessary. You don't want residents or their family members to have to guess what you are thinking. If there are certain restrictions or rules, communicate these clearly and in a direct manner for the health and safety of your resident. At the end of the day, communicating effectively will play an important role in your job. As information passes between nurses, residents, coworkers, and family members, the responsibility to correctly relay and interpret routinely falls on you. Providing the best care possible cannot happen without effective communication. Talking with supervisors and managers can be difficult, even for CNAs who feel comfortable and confident with their communication skills with residents and caregivers. In a perfect world, everyone would communicate freely and honestly, and there wouldn't be any barriers to getting information to the right person at the right time. In reality, though, there are several reasons why staff may not speak up about a problem or concern. The different nursing and management roles in a facility can be intimidating and can sometimes get in the way of open communication. Supervisors are often busy with their own duties and may not regularly check in with their staff. Members of management may be poor communicators and discourage conversation. CNAs sometimes mention the following as major reasons for not telling supervisors about issues they are concerned about. They don't want to complain. Some CNAs worry that their concern may sound like a complaint. They don't want to get anyone in trouble. Members of a facility's staff work closely and often spend more time with each other than with other people in their lives. As such, friendships form, and it can become difficult to talk about work-related issues or problems, especially if they involve a coworker. They think their concerns might be ignored. In some facilities, there is a clear power difference between the CNAs and the nursing supervisors. CNAs might think they're not respected or that their input doesn't matter. They don't want to appear nosy. Nobody wants to be called a gossip. Some people don't communicate because they don't want to seem like they're too concerned with other people's business. They don't think anything will be done about it. Maybe in the past you mentioned that a resident's hearing aid has gone missing and nothing was done about it. That doesn't mean that no one listened. The day-to-day operations of a facility can take many hours and many dollars. Some things require time or money that is not immediately available. Do your best to communicate your concerns to management about ill-functioning equipment or processes. They assume management already knows. The charge nurse or nursing supervisor spends hours every day walking the floor and speaking to CNAs. He or she would know if something is wrong, right? Not necessarily. Just like a CNA, a nurse has a lot on his or her plate and may not notice something that seems obvious to the rest of the staff. That is why you should never assume that your supervisor already knows about your concerns. In the nursing home setting, management should encourage open communication with staff and make it clear that supervisors will listen to and respect them. CNA should know that the reasons we just discussed might be valid concerns, but they should not be used as excuses for keeping silent. Focus on these tips to improve your communication with others in the facility. Listen, don't assume you know what someone is going to say. Don't interrupt. Just as you want your supervisor to listen to concerns, listen to his or her response. If you're confused, say so. Try to see the point from the other's perspective. Be honest. Suppose a piece of equipment broke when you were using it. You may be afraid of getting in trouble and decide to keep the information from your supervisor because you think he or she will be angry. But it's better to explain what happened. Don't leave it for someone else to discover. Be understanding. If nurses or managers don't respond to you immediately, understand that they are busy and may have other things on their mind. Even though your concerns may be important, They may have more pressing issues to deal with before they can address it. Try not to be defensive. Suppose you tell your supervisor about a coworker whom you believe is mistreating a resident, and he or she seems irritated or asks if you can prove it. Because of their response, you might think your supervisor doesn't believe you. It's common to feel upset when you think someone doesn't understand or believe you, or that he or she isn't listening to you. Try to stay calm and explain the situation again. Communication is a very important part of your role. Communicating with residents, family and caregivers, coworkers, and supervisors in a way that shows your respect for them provides greater opportunity to arrive at successful outcomes. Remember, it is not what you say, but how you say it that shows your commitment to successful communication. Remember our motto: what is good for the resident is also good for daily caregivers. Residents are unlikely to get high-quality care if the person caring for them, you, their daily caregiver, is stressed, burdened, and feeling frustrated throughout the day. Practicing good communication skills can reduce your stress level and improve your confidence at work.